My name is Darnell Placewise, and I'm the Public Information Officer for Delta County. Delta County has had our Emergency Operations Center open for just a month now. We thought it was a good time to come back to you and provide an update from our Incident Command team as well as our medical experts. We have Robbie LaValle and Jody Rober from our Incident Command team. Robbie?
Thanks, Darnell, and certainly we want to again just appreciate all that Delta County has done. When we look across to what has been accomplished in the last month, we can definitely see the benefit of the county stepping together in cooperation with the Public Health Department as well as the hospital to make sure that the objectives of our Unified Command are met and that we're providing the relevant information that's critical. We're providing the ability to respond to issues that come up on an hourly basis, and then again, just continuing to provide that coordination. As you look at our plans that are put out daily in our situation report as well as on our social media and print media and other forms of information, then you see that our plans are ready, not only for the hospital, but also for the additional response if needed, if we continue to see additional cases and we need to set up other facilities. And so to speak about directly the case management and the increases in case, I'll turn to Jody.
I just want to share that we as an emergency operation team and hospital, county, and health department, we want you to know that we are prepared for all cases that present to us. We have seen a slight increase in our numbers over the past week. We have seen a few people in the hospital, but currently we have no positives in our hospital at this point in time. We want you to know that no matter what your healthcare issues are, it is safe to come to Delta County Memorial Hospital. We have isolated, when we have people that we're testing to see if they're positive, whether it's in our ER, in our OB department, and any of the units within the hospital or within any of our clinics, we have separated and isolated those patients from everyone else, including the staff that are caring for them. We want you to understand it is safe to go to a medical clinic today. As a matter of fact, we are concerned that people are putting off health care that needs to be managed at this point in time, and we want you to seek out professional help, whether that's through telemedicine or in person. Know that your safety is our utmost concern, as well as those of our healthcare workers. I want to thank the community for their efforts to make gowns, isolation masks, and as well as shields. We've had an outpouring of support from Delta County, the community in Delta County, and I want you to know it's made a difference. We are no longer feeling that we are going to not have personal protective equipment for our healthcare providers. We still need to stay on top of it and make sure we're adequately staying supplied, but you have made that possible, and I cannot thank you enough. So please know that it's safe, that you need to continue social distancing and all the precautions, but please continue to seek healthcare as needed. Thank you.
And now we'll turn to our medical experts.
Hi, I'm Dr. Jennifer Craig. I'm an emergency room physician at Delta County Memorial Hospital, and I am also the operational director for our Incident Command. I am here just to talk to you a little bit about what's going on at our hospital. We have so far tested 182 people through the hospital. There are 15 positives known or reported in Delta County currently. We have 7 pending tests right now through the hospital. We are still testing people through the hospital. I want everybody to be assured that if you need a coronavirus test, then you will get it. We do have to limit our testing to certain testing criteria. For instance, if you are older than 65 years old, if you live in a residential center, if you are symptomatic and have convincing symptoms of coronavirus, which would include things such as fevers, cough, shortness of breath, sore throat, then you will fit into a category and be tested. If you are asymptomatic and just want to know if possibly you've been exposed or have coronavirus, it is unlikely that at this time you will get tested, and that is just simply due to our critical shortage of the testing material and that's a nationwide phenomenon. In Delta County Memorial Hospital, we are seeing more people through the emergency department who do have respiratory symptoms. We have admitted a few people who have thankfully recovered. And we are taking all precautions, as Jody Rober said, that to make sure that we're isolating our respiratory from our non-respiratory clients. So our course through our emergency department is a little different than maybe what you're going to be used to, but it's done to protect yourself, our patients, and our staff, and make sure that we're appropriately triaging patients. Again, we have had people who are under suspicion or may have coronavirus admitted to the hospital. Currently, we have none, but we've also isolated, as Jody said, several of our wards to care for those patients. So I want to make sure that everybody is aware and reassured that Delta County Memorial Hospital is here and able to care for you. And we are actively doing testing, and your testing will be based on your risk factors and your symptoms.
Hi, I'm Dr. Susan Bright. I am the Medical Director for Delta County Public Health. First of all, the Health Department would like to say thank you to all of you who are obeying the Governor's stay-at-home order and helping us flatten the curve. We are seeing a flattening of the curve in the state of Colorado, and that is as a result of you following our stay-at-home order. Unfortunately, locally we are seeing a small increase in cases. This is to be expected, as we've had just a small number so far. Public health usually has more resources that we can implement to try to stop an epidemic. During the H1N1 epidemic, for instance, we were able to vaccinate and start slowing the virus. We're not able to do that because we don't have a vaccine. This makes the stay-at-home order even more important. Public health has 3 important roles in this outbreak. First is to contain the disease. Second is to work with the hospital, other healthcare providers, and other facilities like nursing homes, assisted living, businesses, schools, and daycares to help them have the best information to continue to contain the spread of this disease. Thirdly, we need to ensure compliance in our community with public health orders and assist businesses and agencies with compliance and enforcement if necessary. I also wanted to take a moment today to talk about contact tracing. This is it's new word in the lexicon for many people, but is an old concept in public health. It is one of the primary charges of the health department, and they are well versed in doing this. This virus has been a particular challenge for the health department because we have had such limited testing, as everyone knows. However, these supplies are becoming more available, and the health department is hopeful that we will be able to perform more testing in the very near future and do more effective contact tracing so we can sort out all the cases of the virus and the people who have been exposed to those with the virus. In ideal world, we would be testing everyone who came in contact with a known case. However, because of the limits on our testing, we're using this test much more judiciously, but we are still working very hard to make sure those who are symptomatic and who have been exposed to the symptomatic are placed in quarantine to prevent this further spread of this virus. Contact tracing is very methodical. The contacts of positive cases are assessed as far as their risk, from low to high. A low risk might be passing someone on the street, and a high risk might be your spouse, for instance. And proper investigation is done for those most at risk for having contracted and most at risk for spreading the infection. Depending on the risk, contacts may have to self-quarantine for up to 14 days. And during this time, the individual would be monitoring themselves for symptoms, such as taking their temperature, and being sure to stay away from other people. We still have lots to learn about this virus, but there's 3 very important things that we can all do to help stop the spread. Stay at home, wash your hands, and if you leave your house, be sure to wear a mask. And stay 6 feet from everybody else. Thanks a lot.
Hi, I'm Dr. Sarah Knudsen. I'm a pulmonary ICU physician at Delta Hospital and also involved in the planning response with the incident command team at the hospital. I have been asked today to speak about reiterating the importance of social distancing in our community, as well as comment on the ongoing emphasis on routine use of masks. As you can see within this video discussion, all of us are being very compliant with our mask use, and we're asking the same of individuals in the community for reasons I will outline in just a moment. As we know from reviewing the news, the concept of social distancing, that is minimizing collections of large groups of people and avoiding close encounters or personal contact with individuals in your immediate area, is working both at the national level as well as within our county. I feel that one of the reasons our county's numbers have been so modest is because we are favorably a geographically diverse community and our population density is quite low. So as a typical day goes on, we actually embody most of the concepts of social distancing. However, county members can continue to help us, your healthcare providers, in avoiding a swell of disease activity by continuing to practice social distancing. Even though the numbers have remained low, this is not the time to become cavalier or casual about the benefit of social distancing. Social distancing applies to minimizing social gatherings, affairs like church gatherings or dinners in somebody's home. I'd like to reinforce it also, especially with your children. We know that children generally enjoy a more favorable disease course in the setting of coronavirus. However, they can serve as disease vectors and expose others, such as elderly or people with disease factors of increased risk, to infection with the disease, and those individuals may then have a more severe course or difficult time. So I want to reiterate the importance of continuing to discourage your kids from congregating together in the manner that they might normally enjoy. That's entirely the reason why schools are closed down and we're all going through periods of online learning. So we don't want to undo the benefit of that sacrifice by being more liberal with children gathering together in social settings. I'd like to discuss briefly about the role for community mask use. As I travel around in the community, whether it be in the grocery store or at the gas station, what I see is that mask use is quite variable within the community. We want to encourage you to use your masks when you're in public places. The reason for this is that we know individuals can be while asymptomatic, can be still contagious and infect others during the course of their disease process, especially early on in the course of their disease. Mask use, by the way, does not take the place of social distancing, and those two factors must be used in a combination to have the most effective benefit in terms of sparing people within our community who are at increased risk of severe disease, and continue to allow a blunting of the prevalence of disease in order to allow your healthcare system to be best able to meet the needs of individuals who do become ill. We're ready at the hospital to care for those requiring admission for moderate or even more severe disease that might require our medical surgical ward admission or even into the intensive care unit. But you can do us the best favor by continuing to practice the techniques of social distancing as well as mask use. And I think this will go a long way towards allowing us to meet your medical needs as we go forward in this pandemic process. Thank you very much.
You have heard from our medical experts, and you've heard from our public health department, and you've heard from our hospital. We are ready with our plans. We are responding to the community. We have looked at the cases as they increased, and again, our plans have worked. And as the citizens, again, start to go back to business, then we have our reopening plan, and we're building that. That reopening plan means that we look at what happens to our facilities and how do we stage that reopening? How do we look at that? What PPE does our businesses need for that reopening? And we're already building that into Delta County Business Recovery Plan. Where can our businesses find those additional resources? Part of the additional resources have been set up where we have this response loan that was set up by Delta County Commissioners. This is in cooperation and coordination with Region 10 as well as Uncompahgre Development. We will have additional dollars from municipalities as we move forward. But right now we know that there are federal resources that are in place to help small businesses here in Delta County. But to bridge that gap, because there has been some complexities with those federal resources, Delta County Commissioners allocated $250,000, again in cooperation with Region 10 and Uncompahgre Development, to help our local businesses. We've got a specific website and email set up, businesssupport@deltacounty.com, where businesses can apply for up to $5,000 each, again to help them during this period when they have been impacted by either the economic downturn or the economic shutdown, depending on the business. So again, Delta County is here. We are building our reopening plan. We are here as the resource. We have set up the loan fund to help our businesses. And as we move forward, we'll be providing additional details not only on our website, but in printed media and social media as well. I want to thank everyone again in Delta County. You stepped up just as you always do and provided that PPE for everyone, including our first line defenders as well as our grocery store workers, everyone that has worked so hard for this. I want to thank our health department and our hospital again for this unified approach to tackle the pandemic, to answer the community questions, to provide the resources that we know are necessary to get us all through. Delta County is ready. Delta County has been ready. Delta County has operated as if we've had this COVID with us, because we know we have, and we'll move on and we'll open for business. And again, thank you to everyone in the community for all you've done.